Today we are going to talk about another question from ENT. So, a 74-year-old man with 15 years history of diabetes is hospitalized because of the end-stage kidney disease. His tongue and the inner side of the lips and buccal mucosa are covered with white, slightly elevated soft patches. What is the most likely diagnosis? Aphthous stomatitis, candidiasis, herpes labialis, pyogenic neuroma, or xerostomia. So we can see that the patient is a diabetic patient, and diabetic patients their immunity is weaker than that of the normal person. That's why they're more prone to get infections, and the healing process is also weaker in such patients. That's why the opportunistic bacteria, they get a chance to proliferate, and they can cause various infections. And this patient has also end stage kidney disease because of the diabetes, so he's also suffering from diabetic nephropathy. So if we look the image closer, we can see that there is a whitish membrane covering the tongue and the buccal mucosa as well. And the difference between the candidiasis and that of the other infections where we can see such whitish patches like diphtheria, the difference is that in diphtheria, if you try to remove the white membrane, it will be difficult and there will be a bleed, while in case of candidiasis you can easily remove the white membrane. So candidiasis also termed as the oral thrush or moniliasis. Candidiasis is caused by a yeast-like fungus, Candida albicans, which is a common surface inhabitant of the oral cavity, gastrointestinal tract, and vagina. Oral candidiasis is most common in people with immunocompromised system or with diabetes, and the incidence in patients with AIDS is approximately 40 to 90%. The oral lesions typically appears as a white, slightly elevated, soft patches that consistent mainly of fungal hyphae. So in this patient, the answer is candidiasis or oral thrush. In aphthous ulcer or aphthous stomatitis, you can find small ulcers in the oral cavity. Herpes labialis, where you can find painful vesicles in group. Pyogenic granuloma, you can find pus, and xerostomia, where the mucous membrane become dry. So in this condition, the answer is candidiasis.